Hey everybody, welcome to Pick Dr. Osborne's Brain. Today we're going to be talking all about helping you prepare and recover from surgery, the scheduled trauma that surgery is. Many people go into it malnourished and unprepared and have bad outcomes or bad complications as a result of being malnourished, especially those with gluten sensitivity and celiac disease because of years of gluten-induced malnutrition. And so they walk into something that they're just not really going to do well from. Hopefully that's not you or hasn't been you, but we're going to dive into what you can do to prep for that and answer your questions. So if you missed Tuesday's show, I went into some of the depth of malnutrition and surgery and some of those complications and why they arise. But I want to take the time today to answer any questions that you have. So if you've got questions, go ahead and pipe those into your feed, and I'll do my best in this next hour to get those questions answered. So we've got several that have already come in via email. So let's go ahead and dive into some of those. Oh, here's a gallbladder surgery removed decades ago. Since removed, she's constantly had, so somebody's chiming in about their mother having had a gallbladder surgery removed decades ago, since has had chronic pancreatitis, and the doctors have said there's nothing that can be done. I would argue there's absolutely a lot that can be done. One of the things regarding gallbladder surgery, so pay attention, if you've had your gallbladder removed, you know, whether it was a year ago or a month ago or 10 years ago, there should be some things that you should have been told by your surgeon. But a lot of times the nutritional counseling, you know, pre or post surgically is what I have found to be very, very lacking. But what should you take? So if you've got a missing gallbladder, you should be on some type of ox bile supplementation, for sure, because now with a missing gallbladder, you don't have the timing or the secretion of bile to enter your small intestine to help you digest and absorb fats. And so with that being said, you should be taking this before you eat, especially a higher fat food. We actually have on Gluten Free Society a product called Lipogest, Lipogest. It's designed for that very thing, to support people that have had their gallbladders removed. Because you've got to be really concerned. One of the things that happens post gallbladder removal is the fat soluble vitamin deficiency, and that can lead to pancreatic dysfunction and even inflammation. And so, you know, what are those nutrients? It's vitamin A, vitamin D, vitamin E, vitamin K, and omega-3 fatty acids, also acids like oleic acid and short chain and medium chain triglycerides, those types of fats that we get from eating high quality foods. Our body has a harder time absorbing them without a gallbladder. So you want to support yourself, just like, you know, some people have to take a digestive enzyme before they eat to better digest their food. Well, if you don't have a gallbladder, you want to use this to support your digestion before you eat, if you've had that surgery. Let's see here. So what Sarah's asking about, you know, when you're in the hospital going through a surgery and basically being fed, isn't a lot of this, the medicines and a lot of the food, you know, it's full of corn and corn sugar. How can you recover if they're pumping you full of corn? Well, one of the things, this is part of prepping, right? Because surgery is usually it's a voluntary procedure. I mean, unless you're in a medical emergency and you have to have surgery to save your life, most people go into surgery and it's voluntary, so they can plan for it. And one of the things that you definitely want to make sure that you're planning for is that your food is brought into you. You're not going to want to eat hospital food. Hospital food is swill. I mean, it's worse than swill in terms of helping you nourish after a surgery and recover. So once you go into recovery, you're going to want to have all of your food there, especially if you're gluten sensitive. Don't trust the dietitians in the hospital to understand that you need to avoid corn. They're looking at corn as if it's gluten free. They're going to serve you up corn on the cob, cornbread. They're going to serve you up, you know, horrific meat that was predominantly corn and grain fed. So the omega-6 3 fatty acid ratio in that meat is terrible for you. They're going to serve you up processed food. They're going to serve you up things like Jell-O and pudding and ice cream, junk food, right? You can't recover. You can't heal Remember, surgery is scheduled trauma, and you're not going to heal from that if you fill your body full of garbage. And most of that hospital food is just that. So you can plan ahead, right? That's how you plan ahead. The other thing you can plan ahead for is look at what kind of anesthesia, look at what kind of medicines that your doctor's going to want to prescribe you before and after the surgery. A lot of times during surgery, they're going to use antibiotics. But after the surgery is where a lot of the medicines come in, where they're going to want to put you. Generally, they like to use steroids to reduce pain, swelling, edema, and inflammation. And they like to use opiate painkillers or other types of non-steroidal anti-inflammatories to help reduce your pain after the surgery. Well, some people don't need all that. I mean, you can take it, certainly, but the question is do you need it, right? Because we don't really want to necessarily block inflammation post-surgically, at least not in my opinion. Why? Because inflammation is part of the healing process. So, I mean, unless it's just so gruelingly painful, and there are some surgeries that are, and I certainly wouldn't discourage anyone from wanting to be out of pain, depending on the nature of the surgery. But, if we're talking about minor procedure, do you really need all that follow-up pain medication? Actually, I had somebody in my office last week that had a tooth surgery done, and they were put on opiates, and the opiates shut their bowels down for a week. So, remember, opiates cause severe constipation. Even though they reduce pain, they cause severe constipation, and that's the last thing that you want to have, is you want to have your GI tract completely stuffed up and backed up. Remember, your GI tract is where nutrition comes from. So, you've got to keep in mind the medicines that you're going to be willing to take or that you're going to want to take. What's necessary versus what is the doctor prescribing that, is just something he's trying to do to appease the potential possibility that you might have some post-surgical pain and swelling. And I would say, it's a decision call that you're going to have to make based on your comfort level, but check the ingredients of the drugs, because many of the drugs do have gluten in them, gluten fillers. We talked about that a few weeks ago. The proliferation of use of corn and grain and wheat and other grain-based items in the coating of medications and as fillers in medications. So these are all things that if you're going to plan a surgery, you can plan ahead for, and you can ask these questions beforehand. I think it's important that you do if you want to have a good outcome. Let's see. So Melanie's asking, what dose of methylated B vitamins would you recommend for MTHFR mutations? It's not a particular dose, Melanie. I wouldn't make my recommendation of a dose based on whether you had or didn't have an MTHFR mutation. I would make my recommendation of a dose based on your age, your height, your weight, your need. If we're talking about a surgical need, if we're talking about depending on which B vitamin that we're talking about. But one of the recommendations that I have for pre and post surgery is a very strong multivitamin with lots of B vitamins in it. And so, one that I recommend is called multi-nutrients, and it's very, very B vitamin rich, and it's B vitamin rich in methylated vitamins. But the variation itself doesn't mean you need more of that nutrient per se. That's kind of a misnomer. In my opinion, a lot of doctors today are using these genetic SNP tests to pump people full of methylated vitamins that they may or may not need. The best way, if you really want to know, is if you're planning for surgery, ask your surgeon, ask your doctor to run nutritional testing on you ahead of time. And that way you can find out what you're low in, and you can take supportive therapeutic doses pre-surgery to make sure your nutrition is solid going into the surgery. But just to say, because you have MTHFR, you need 1,000 milligrams of folate, of methylfolate, that we wouldn't use the variation to make that call or that decision. Let's see, Chip is asking, is it wise to wait for thyroid blood testing after dental x-rays? I'm not sure the angle that you're going there, Chip. Is it wise to wait for thyroid blood testing after a dental x-ray? You can. If your theory is that the x-ray itself would radiate your thyroid and potentially create thyroid number changes on your blood work, but usually when dentists take your x-rays, they put an apron around your neck and around your chest and everything else so that they're blocking any of that. So just, I would say it's probably not necessary if you're using that, that apron to block the radiation. Best advice for healing from lumbar spinal cortisol injections for pain, 73 years old male, for after a car accident a year ago. So healing from a lumbar spinal cortisol injection. So you're saying that, I'm assuming that you mean that the car accident injured the spine and that the doctor used a cortisol injection into the spine to try to get pain relief and it failed, which is extremely common. A lot of times these cortisol injections don't work. It depends, Elizabeth, it depends on what kind of injury it was. If it was a soft tissue injury, like muscular tendinous ligamentous injury, one of the best things to take is proteolytic enzymes. And so I have a formula called Matrozyme that can be taken for that. But that's one thing that can be taken in terms of a soft tissue injury to support that recovery if it was a whiplash-like injury. Now, if the spine was traumatized and there was a disc herniation or something to that magnitude, supplements may not be the only thing involved, and you probably want to look at other types of treatment options in that case. And one of the best places to go, in my opinion, post-whiplash, post-injury of the spine is a good chiropractor, a chiropractor with a good reputation. Bar none, chiropractors manage spine conditions better than any other type of doctor. If you're looking for more of a kind of a holistic approach versus inject it with a medicine or take an oral steroid, chiropractors, live and breathe spinal trauma. So that's what I would recommend that you do. But also follow up. That person needs to follow up and get nutritional testing, because a lot of times the inability to heal post-trauma, whether the trauma is a car accident or whether it's a surgery, is malnutrition. And so testing nutritional levels becomes very, very important. I know a lot of you keep asking, Dr. Osborne, when are you going to offer nutritional testing? That's coming. We're probably 3 to 5 weeks out of having that available direct to consumer, because it's the biggest question we get. My doctor won't measure my nutrition. They refuse to measure it, or if they do measure it, they measure it in the serum, which is inaccurate. So we're working on it. We're almost there. It's coming, so just be patient with us. I promise you, we're going to have it out soon. Let's see. So I've been working or looking for supplements that can help with pancreatitis. Can you make a recommendation? I mean, if you're trying to support your pancreas, one of the best things you can do is proteolytic enzymes taken on an empty stomach. Again, going back to what I said earlier, Matrozyme is the formula I designed it's a proteolytic enzyme formula. The other thing I probably would have somebody do in that situation with pancreatitis is look at food reactivity, specifically gluten, because it's very well documented that gluten can cause, for people with gluten issues, can cause pancreatitis. So all the supplements in the world are not going to heal or cure an inflammatory process that's being caused by somebody poisoning themselves with the very food that's supposed to be nourishing them. So checking for food sensitivity and food allergy would be a very important step in trying to figure out why that's happening. Let's see here. Mom is fully up. Let's see. Oh, disc trauma. So follow up on that question a minute ago about the car accident. So disc trauma and ligaments. So yeah, disc trauma and ligament trauma, there's really, my advice on the chiropractor stays. A good chiropractor will manipulate that spine, will strip out the soft tissue to break up any adhesions within the soft tissue that oftentimes are there after an accident of that nature. Maybe even traction or decompression of the spine, which is a manual therapy. It's a therapy that stretches the spine, because if the disc herniated out into a nerve and it's putting pressure on the nerve, you've got to take that physical pressure off and allow that irritation to calm down. Those are all other, outside of nutrition, those are all very good therapies that you can ask a doctor about. And then to support the trauma aspect, aside from proteolytic enzymes, a good source of collagen as well as vitamin C, zinc, and quercetin. And vitamin C and quercetin, 5 grams a day would be where I would put somebody if they were coming to me. And then zinc, I would probably put them on about 100 milligrams a day. But at the end of the day, too, I would also test their nutrition status and fill in the gaps, fill in the blanks. Let's see here. Mother, 87, in good shape, broke her femur in February, was operated, general anesthesia. 2 weeks later, got COVID while in rehab. Since then, has more dementia, gets stuck in problems. B12 injection, don't do. I'm not sure I see the question in that. Well, I mean, okay, so I think the bigger question is, after all this has happened, her mind is not as sharp and not as good as what it was. You know, if that's the situation, really, you could do some generalized things to potentially support brain function. You know, always start with a good quality multivitamin. You can never go wrong in that regard. But number two, we want to look at potentially blood-brain barrier magnesium, so magnesium threonate. I would have somebody, taking with signs of early memory disruption, taking something called magnesium threonate. We have something called ClearMag, which is what that is. And so anywhere from 200 to 400 milligrams a day of that, because that carries magnesium past the blood-brain barrier, so it helps get magnesium into the brain cells a lot better. And there's a lot of early research studies in animals that show that that it actually helps with their dementia and their cognitive decline. So that's one that you could certainly make an attempt at using. Beyond that, I would look at food as a culprit, because if she's had that kind of trauma, the fracture plus COVID, plus God knows what they did to her in the hospital, if they treated her the way the way a lot of hospitals treated, which is, with kidney toxic remdesivir and some of these other horrid, in my opinion, horrid medications, then they could have created some problems for her, and now those are still lingering. And so that would be, again, we're working with an expert and functional would be the best thing to do if you're really, really concerned about getting her better. Okay. Let's see here. Ileocecal valve was removed 15 years ago due to Crohn's. Is it possible to recover from malnutrition without it? Could SIBO develop without the valve? It could. Is it possible to recover from malnutrition without? Absolutely, Silvio. What you want to do, though, is in that type of scenario, if you've had part of your colon removed, part of your intestines removed, if you're going to recover well, you've got to get tested. No. I mean, you can take good quality multi, you can take other individual supplements, and you can guess about what may or may not be necessary. When you remove that ileocecal valve surgery, a lot of times they also chop out a little bit above and a little bit below, and so what you're ending up with, the potential in that geographic location, that's where iron goes in, that's where B12 is absorbed, and so those are two nutrients that you might have a greater risk of ongoing lifelong deficiency. And so getting those checked on the regular, twice a year, as kind of a minimum to be able to assess whether or not that surgery is leading to persistence and causing malnutrition as a result of removing the organ itself. Let's see here. Yeah, so on the question of nutritional testing, Mickey was asking, what kind of testing for nutrition do you recommend for pre-surgery? I recommend intracellular testing, not serum, not plasma, not hair testing. All that's a waste of time. It's going to give you misleading information that isn't going to be very helpful or fruitful in guiding you on what you should be taking. So intracellular. That's what we've got coming here in the next few weeks. So again, I mentioned that earlier, be patient with us. What if you can't tolerate high doses? Post-surgery triggers digestive difficulties. Cheryl's asking. So it depends on what you're talking about. Everybody's different in that regard. So if you go, we have a link, I think we put it below or in the feed, but it's a link to a page at Gluten Free Society, which, by the way, I didn't announce this, I'm supposed to announce this. Let me pause. for a break from our sponsors. Who's our sponsor? Gluten-Free Society. And so we're going to put that link up now. And this page is a generalized information page about nutrients that you can take before to prep for surgery and after to help and aid and support your recovery after surgery. So this page lists out those things. Now, you may find those doses to be intolerable if you know, for example, one of the recommendations is for an adult is 5 grams of vitamin C and split into divided doses over the course of the day, post-surgically and pre-surgically. And so some people don't tolerate 5 grams of vitamin C. It gives them gurgling bowels and diarrhea. So in that case, you know, that individual may only need to take 2 grams or 3 grams. So it's always, you know, again, it's a case-by-case basis because there's no two individuals that are exactly alike. And so you wouldn't look at that protocol and say, everybody does exactly this and there can be no changes. You have to take it in with what what you're capable of tolerating. As a general rule, though, that protocol, there aren't going to be toxicities that are created. It's more than anything, it's just individual reactions. Some people take zinc and it makes their stomach upset. Some people take too much vitamin C and it gives them a loose bowel. So again, they're just individual types of reactions like that can occur. And usually experience gives us the knowledge of what that is. Let's see here. What's the best way to take ultra aminos? So we were talking about ultra aminos during the show on Tuesday. And what are ultra aminos? This is part of my post-surgery protocol. There are the essential amino acids that are necessary to form collagen and structural proteins that aid in healing and repair, right? And so you're taking extra. One of the biggest failures post-surgically for people is they don't get enough protein, especially with this war against animal meat, this nonsense that's going on. Let's all save the planet by destroying farms and not allowing people to raise cows and taxing farmers into oblivion. It's all nonsense, it's all rhetoric, it's all part of the green movement that really has nothing to do with anything other than taxing everybody a little bit more and making us all a little bit less healthy so that we can't fight back against a government that's gotten more and more aggressive into our personal lives and freedoms. Anyway, enough on the rant. You gotta have protein to recover from surgery. How much protein do you need? And not plant protein, by the way. Plant protein is not highly biological valued protein that contains all of the essential amino acids that's going to allow you to recover efficiently. You need animal-based protein for this. And so if we're just doing a general calculation, you need about 2 grams of protein for every kilogram that you weigh. So, if you want to figure that out, if you're in the US, you probably know your weight in pounds. Well, you would divide that by 2.2 and that would give you kilograms, and then you'd multiply that by 2 and that would give you grams of protein per day that you need to recover post-surgically. You need 2 grams of protein per kilogram body weight to support recovery healthfully. The average American gets, if they're following a plant-based diet, it's somewhere around 0.4 to 0.6 grams of protein. So think of this, it's like 20% of the necessary ingredient to recover and heal from that surgery. And that's why, another reason why so many people fail to recover well. I see this a lot. No offense if you're vegan or plant-based. I'm not picking on you guys for being plant-based. Some people do better on a plant-based diet, but you've got to put meat in there because meat contains nutrients that plants don't. And usually you got to put some kind of fish, a pesco vegetarian diet, some kind of egg, something in there where you're getting a complete source of animal-based protein to supply your body with the building blocks to heal and repair. Because remember, surgery is a different beast. You're recovering from trauma. It's not like day-to-day maintenance. You're recovering from trauma. Let's see here. Paula says, yesterday I had an abdominal ultrasound to check for gallstones. I have some symptoms, but I don't want to have gallbladder removed if I don't have to. What do you think about ursodiol? Not much. I would say if you've got stones, you've got to figure out why you have stones. Some people will do what's called a gallbladder flush to flush stones out, but a lot of times, in my experience, the biggest reason why we'll see people start to develop the gallstones themselves is poor diet. Heavy carbohydrate diets contribute to gallstone formation. Lack of choline, choline deficiency, taurine deficiency, vitamin C deficiency can contribute to gallstones. You know, a lot of times people go to the doctor, they find the gallstones and they say, oh, you have stones, therefore we need to remove this organ. This organ's not an essential organ, it's not important. I would argue and disagree all day long that that's a terrible idea to remove an organ because you've got stones. You got to ask a better, smarter question. Why do the stones exist? Is bioresonance test good for nutrient testing? No. Let's see here. Almost all friends and family are on multiple drugs. I want to explain why they are harmful. Do what they can to get off them. I think if you're trying to do that, you just got to keep in mind that people that are okay with taking drugs and don't want to hear about diet and nutrition, you're not going to convince them. You know, I think it was Mark Twain that said it's easier to lie to somebody than to convince them that they've been lied to. And I think, and maybe I'm paraphrasing that wrong, but that's the general gist. And I think you got to understand that if a person is on the philosophy side of, I'm going to medicate my illness because my body has no innate intelligence and it's dependent upon these magic pills in order to keep it going, you're not going to convince them otherwise. You can only convince them by being, you know, the old, I think it was Michael Jackson, be the man in the mirror, right? It's be the change you want to see in the world. And so lead by example. When they see your health and your vibrance coming through, that might open the conversation or the doorway up to, hey, what are you doing? And what do I need to change? Because people don't change because they hear facts. People change because they see stories, they hear stories. That's why, you know, any of you that are religious, Jesus always taught with stories. He didn't teach with facts. He didn't try to convince people based on facts. He taught people through stories, because through stories we can connect with others and disassemble their, you know, a lot of people are just super on guard and skeptic about nutrition and about alternative healthcare, because that's what they've been conditioned to believe. And so if you try to give them a bunch of facts to convince them they were wrong, you're probably not going to succeed. But if you share stories, other people, maybe, you know, if you got a cousin with a gallbladder problem, you share a story about how you overcame your gallbladder problem and this is what you did. Like, that's the way you get through to people, not through just regurgitation of facts. Let's see. I like that. Juan says the green movement's all about the green dollar. That's right. It's a bunch of BS. And anybody who says otherwise, look at their background and look at what they're pawning. Melanie, will you please offer more information on cooking, overlooking vegetables? You had mentioned a problem with high temperatures. Would love to learn more about healthy cooking techniques. Yeah, we can do some of that in the future. Any thoughts on blood pressure dropping to 87/46? My mom is 86 years old and this happens to her every time she eats a medium to large meal or is carb laden. There's a lot of thoughts on why that could be dropping, but one of the biggest reasons blood pressure can drop post meal is the blood goes to your gut. It goes to your GI tract. It moves out of your periphery, out of your brain, goes to your GI tract to help you digest the food that you're eating. And so it's not uncommon to see blood pressure coming down after a meal. But the other question I would have, if she's 86, you know, is she on polypharmacy? Is she loaded up like most 86-year-olds? 86-year-olds are on, you know, 6+ medications. And so, you know, a lot of times the blood pressures are over the map or all over the place because they're being aggressively medicated, and there's not, maybe there's multiple doctors involved, and sometimes what happens is nobody does a medication review, and so you got conflicting medications, or you've got the doses too strong or too high for a particular individual, but nobody, you know, everybody, when it comes to cholesterol and blood pressure, all doctors think less is better, right? And you get to a point where less is not better, where less is detrimental, but at any rate, those would be things that I would think about investigating with your mom. Let's see here. So this question came in, is it possible to get all the nutrients from whole grains through other foods? So I think the question is referring to, if you're eating no grain, is it possible to get all the same nutrients that you would get if you were eating grain from other foods? And the answer is absolutely yes, and it's probably much easier. Grains, are a terrible source of nutrition. They contain a ton of phytochemicals like oxalates and other lectins that not only can drive and trigger inflammation in the gut, leading to malabsorption, but the oxalates themselves can make it very difficult for you to absorb the minerals from those types of foods. So grain-based foods contain a lot of that. And that's why the bioavailability of things like iron and calcium and zinc and magnesium and selenium and chromium and copper is poor. Mineral bioavailability generally is very poor from eating grain. So to answer your question, yes, you can get probably better nourished as a result of cutting grain out. There's no human requirement for the consumption of grain. Everything you've ever heard in that arena is generally, I'll say, propaganda, either from the industry, right? The grain lobby is a very, very powerful industry. We subsidize the growth of a lot of the grain-based crops, meaning our tax dollars pay for those. In an effort to produce a ton of different things, not just food, but biodiesel and some of the other green movement uses grains to produce plastics. And so, it's a whole business of trying to push the benefit of grain. There's a whole business behind that most people aren't aware of. If you want to learn more about that, I would encourage you to go back and watch. We did an episode on the dark side of the history of cereal, called Cereal Killers, and you can go back and check that one out if you want to learn more. Okay. Why would my amino acid status be so unstable? Now I'm threonine deficient, where a year ago I wasn't. I can't comment on that because I don't know how you were tested on that. So I would argue what was the methodology by which you were testing your amino acid levels. If you're doing plasma amino acid levels, they can shift quite rapidly from day to day, week to week. Again, if you're really wanting to test specifically, you got to do intracellular analysis of those in order to understand whether or not they're really low, or whether or not your diet yesterday was just a little bit lower in one versus another. Okay, do we have the FB feed? Let's see, Valerie says, I had one cataract surgery 6 months ago and it's still not healed. I'm totally gluten-free. Have thyroid issues. Anyway, can you recommend anything to help with healing? Docs can't find any issues. Yeah, I think if you're not healing, one, Valerie, I would start with just things that you don't have to test for. I would just start by making sure you're getting adequate protein. Again, 2 grams per kilogram body weight of protein to recover. The other I would consider, right away, is just doing the post-surgery nutrition protocol. I mean, it's generalized, and so it may not be exact for you, but it might be very, very helpful in that regard, to just giving your body more of what it needs, to support that healing process. And then if that is not working, then what I would look to do is get tested. Because at the end of the day, testing is going to give you a much better and more accurate blueprint on what you need than just kind of generalized nutrition. Let's see, Lise asks, do you record these live sessions? If yes, where do I find them? Let me put a link up. Lise, go to our YouTube page, to our YouTube channel. Everything is archived there. And just make sure when you go there, subscribe and hit the little bell button. And that way, if you want to get notified when we do go live, you can always get that notification and you can join us. And if you don't, and if you can't join us, you can always set yourself up when you get that notification. You can go back later and watch it, because we'll send you the link in the update. Okay, let's see here.
That's the bottom of Facebook for now.
Okay. Let's see here. Let's see. Michelle says, I have a question about myself. I've been diagnosed with viral vestibular labyrinthitis. My doctor wants to put me on valcyclovir. I assume that's what you mean. Any supplements that I can take instead? Well, I mean, the question that I would say is understand what valcyclovir is, which is an antiviral. So if how do they know you have viral vestibular labyrinthitis? I mean, that would be, there's a lot of things that can cause vestibular labyrinthitis. So for example, and a lot of times when doctors don't know the reason, they're speculating that virus might have something to do with it. So, you know, unless he's tested you and confirmed that you have a viral infection and they're certain about it, I would probably sit down with that doctor and ask him a bunch of questions and just going to get better clarity on whether or not that's an accurate diagnosis. So that's part one. Part two would be, let's say it is viral. What are the things that you can take to support yourself if you have a viral issue? High doses of C, high doses of L-lysine, high doses of zinc, elderberry, andrographis. I have a formula that we use. It's called Virid, V-I-R-I-D. I'll put a link up for you on that one. And that would be something that, you know, if I were struggling with a viral related issue, that would be something I would take to support my ability to recover. Let's see, my opinion on healthy whole grains like oats and quinoa. Well, first of all, if you're gluten sensitive, there's no such thing as a healthy whole grain. If you're not gluten sensitive, you know, we could argue the pros and cons or merits of using things like organic whole grain oats, although the vast majority of oats in this country are not whole grain. They're labeled whole grain, and if you understand what that means on a food label, you'd be surprised. Quinoa is not a grain, quinoa is a seed. It's a pseudo cereal or a pseudo grain, and I don't have a great opinion of either one for several reasons. One, aside from fiber, there's very little nutritional value from either one of those food items. So, I mean, if you're just trying to get your fiber intake up, I guess you could use them for that, but there are other things that you could eat that are more nourishing and higher in nutritional density than grains and pseudo grains that will also provide you with fiber. So I'm not a really big fan of oats or quinoa. And the other thing about quinoa that we know is that it actually has a protein or a couple of different proteins in it that mimic gluten. So a lot of people that, you know, they're going on a gluten-free diet and they're just eating quinoa everything instead of wheat everything, they're actually still reacting and having a hard time with flare-ups and inflammation as a result of that protein in quinoa mimicking the gluten itself. So it's not something that I would encourage anybody to do, especially if you're trying to follow a gluten-free diet. The myth is that oats are gluten-free, which isn't true. And if you want to learn more about that, we can also put a link up for you here on that so you can learn more about gluten-free oats. And we can also put a link up for them on the quinoa and on the studies and research that show that quinoa can create problems in people with gluten sensitivity. So again, both those are not something that I would encourage a lot of. Is it safe to eat hemp and flaxseed? It's okay to eat hemp and flaxseed. I think a lot of people fool themselves on the aspect of hemp and flaxseed as far as omega-3 is concerned. This is especially true of people that I've seen who are vegetarian, who don't want to eat any animal meat at all or any animal product at all. Is they're trying to get their omega-3 fatty acid through plant-based items, and you're just not going to achieve anywhere near a high enough level of EPA with seeds of any kind, flaxseed, chia seed, hemp. None of those are going to have enough to really do much for you. But as far as eating them, you can eat them, provided that your GI tract is robust and healthy and doesn't struggle for digesting, because seeds can be for some harder to digest because of some of the anti-digestive lectins and other things in them. So it's one of those things you take on a case-by-case basis. I like that. Juan's quoting Hippocrates. Before you heal someone, ask him if he's willing to give up the things that make him sick. And that really is the core of the question. Let's see here. Go back up just a little bit. Chris had a question I think I missed. Yeah, Chris. So I had surgery 5 years ago to plug a superior semicircular canal dehiscence or dehiscence, and still have really loud tinnitus. Anything to calm the noise in my head? Yeah, I think so. If you had surgery and that was, I don't know, you didn't mention whether or not it was helpful, but I would say diet change. A lot of times where I see tinnitus is inflammatory nerve damage to the vestibulocochlear nerve. And there are a lot of foods that we know can trigger that. And there are a lot of nutritional deficiencies that we know can contribute to that as well. For example, vitamin B12 deficiency, folate deficiency, vitamin B6 deficiency, copper deficiency, calcium and magnesium deficiencies can all contribute to that. Gluten certainly can cause vestibular tinnitus, as can many other foods. Dairy, gluten are probably two of the top I've seen directly when people remove those from their diets, found an improvement in tinnitus type symptoms. So those would be places I would start, Chris. And I would, if you don't have a copy already, I'd encourage you to read No Grain, No Pain. And there's a diet, a 30-day diet in that book you can follow. And I would just suggest that maybe you try that for 30 days and see if you don't get some improvement or reprieve from the tinnitus, because that's a miserable way to go. Let's see, any supplements for long COVID? We have an immune protocol, and we can put, Ral, we can put the link up to the immune protocol for you if you'd like to check that out. So that's just an immune support protocol, whether it's long or short. But I would also just make mention that most of the people that I have seen that think they have long COVID don't. They actually are in mold, and they're not recovering because they went home to recover from the illness and their house has mold in it. And so they've just basically surrounded themselves by the poison of mold and mold toxins. And so it's just continuing to suppress the immune system and not allow them to recover post-COVID. Guy is asking, when your food sensitivity labs come available, are you contemplating to do a seminar course on how to look at them? Yes, it's actually going to be part of when you buy that's one of the things that it's taking us so long to make sure that we have it all settled up for everybody, so that they, when they do it, they have an explanation of it. Because I mean, everybody that does it, I'm not going to get on the phone with them personally. I don't have time. To add that kind of a level of service. So we do have something like that we're planning. Are green bananas okay to eat if you can't eat regular bananas? If you're allergic to bananas, if that's what you're asking, no. If you're eating green bananas because you don't want to eat regular bananas because they're too high in sugar, green bananas are a lot lower carbohydrate-wise. The sugars have not blossomed yet in those green bananas. So in that regard, yes. What's the best way to take B12? It's not necessarily a better way to take it. If you're using a lozenge, the best way is to suck on that lozenge and let it absorb through your cheeks. Don't swallow the lozenge, or don't crunch or chew the lozenge up. B12 can absorb through the cheeks. So if you've got a history of stomach issues as a result of gluten damage, a lot of people have problems with B12 absorption because of that. And so a sublingual lozenge is one of the better ways to take it. With or without food is irrelevant. Okay. Let's see here. Can we have a show on how to read and understand blood work? No. If you guys want to go to school for 11 years, that is the show. It's an 11-year education. I don't think I could teach that in a 20 or 40-minute show. And a big part of blood interpretation and lab interpretation is understanding anatomy, physiology, biochemistry, pathophysiology, pathology. And if you don't have a really strong scientific background in those things, it doesn't matter how much I try to teach it. It'd be like trying to teach the game of baseball and you've never picked up a bat, and I'm trying to teach you how to hit a home run on the first day. That would be probably the best analogy I could give you. It's just, It's a hard ask. Thoughts on AFib, 86-year-old woman, no prescription drugs, bypass surgery 11 years ago. Check the minerals. I mean, that would be the first thing I would do with AFib, magnesium, calcium, potassium, check them, make sure they're okay. A lot of AFib I have seen get a lot better with just magnesium supplementation. So that would be one of the things that I would just say off the top of my head that I would check. Okay. Did we get through them all?
Looks like it.
Opinion on ivermectin? You know, I never used it, never prescribed it. You know, does it work? Yeah, it works. There's I think 67 very solid research studies on using that medicine with a disease that shall not be named, and very, very good outcomes. But I generally tend to lean more on the natural side of things. So I'm a bigger fan of, as opposed to ivermectin, I'm really a bigger fan of artemisinin, and a bigger fan of vitamin C, zinc, vitamin D, vitamin A, quercetin, and melatonin, you know, things that have great track records without any side effect profile to speak of. Is there any way to improve severe osteoporosis by diets and supplements only? I mean, I would say yes. First of all, I would, you know, if she fractured her hip, it is a whole thing to unpack there, because if your mom broke her femur, you know, there's a whole thing to unpack as to how that femur broke. Did it break because she's osteoporotic and she's just so weak that she couldn't walk and her leg fractured, or is there something deeper or something else going on there? You know, in my experience, the people that are on a lot of these bone density medications are at increased risk for fractures, because those medicines make the bone look better on a bone scan, but they make the bone more brittle, so have more pronicity to fracture and microfracture. So, I mean, natural, yeah, good diet, good exercise. There's a lot of elements there, but I would say if she's 87, she needs to get checked. She needs to get nutritionally checked, because beyond that, it's all, you know, guesswork. Does she need calcium and vitamin K and vitamin D? Does she need something else? I mean, there's a lot of potential possibility there. So Melanie is talking about eliminating sugar to clear up yeast. However, I use insulin and not sure what to consume for occasional low blood sugars. Any ideas? You know, I think as you eliminate sugar and you really pay attention to your insulin dose, you'll figure out, you know, how to adjust that so that you're not hitting those points of super low. I mean, if you could use a piece of fruit to bring up your blood sugar, you know, without, you know, damaging yourself and you're compromising your ability to overcome a yeast overgrowth. Just depending, Melanie, I don't know if you're type 1 diabetic or if you're type 2 that has shifted to insulin because you weren't controlling your diabetes. But if you're a type 2 with insulin dependence, you know, that's an easy reversal, diet and lifestyle. If you're type 1 diabetic, that's a harder pill. That's a tougher one. And it takes diligence, it takes monitoring, and it takes time to dial it in. Okay. Well, the question's really coming off now. So when will we have international shipping? We do to Canada currently. Working on a solution in this post-COVID world. We've had a really hard time because of you know, being able to ship supplies into other countries with different restrictions and regulations that are changing on a daily basis. So we've just kind of put that on the back burner until some of this lets up. Remedy for hemorrhoids. Yeah, change your diet, because hemorrhoids are a manifestation of poor diet. I mean, it's a, you know, it's a vascular irritation, and so you get a vascular bubble that forms, you know, usually in the rectum for most people, but and then causes bleeding, and diet irritation is one of the biggest factors involved in that. So you got to figure out what's creating the irritation so you can remove it. And then once you remove it, they go away. I mean, you could use things like witch hazel. Some people apply witch hazel for hemorrhoids as a natural way to kind of get them under better control, but that's a temporary fix. And if you're talking about long-term solutions, you got to figure out what the irritant is that's causing the issue. Okay, I think I got them all. All right, I think I did. So what we're going to do, we're going to wrap it up. Make sure you join me next Tuesday. We're going to be talking about home remedies for aches and pains. So it's going to be a good one. If you've got questions around that, make sure you bring them. And we're here every Thursday, same time, and we're here every Tuesday at 6 p.m. Central Standard Time. So if you want to get more, if you want to learn more, make sure you're joining us. Make sure you subscribe and like and share and comment. The more you do that, the more that's going to help me reach 100 million people. Remember, that's what this is all about, getting to that 100 million mark to save lives and help change the world. Have a fantastic weekend. We'll see you on Tuesday night, 6 p.m. for another episode of the Dr. Osborne Zone. Take care.